Hello, my name is Pyra Haglund. I'm a laser surgeon and I've been working in the interesting field of aesthetic laser surgery for the last decade. In the fields of hair removal and skin rejuvenation, the development has been tremendous, both technically and medically. We started out working with lasers for hair removal, ruby, alexandrite, diode. Then we got IPL, intense pulsed light, which in most of Europe is the golden standard for hair removal. With IPL, we have the possibility to treat darker skin types, and we can also use the same machine but with different filters for skin rejuvenation and for the treatment of pigmented and vascular lesions. Whether laser or IPL, the principle for treatment is selective photothermolysis. The target chromophore absorbs light to certain wavelengths, light energy is transformed to heat, and the target organ is destroyed. In hair removal, melanin in the hair absorbs light, and in vascular lesions, the chromophore is hemoglobin. Let me shortly point out the difference between lasers and IPL. Lasers have light of one wavelength only, for example 755 nanometers for alexandrite. IPL is really a lamp that emits a spectrum of wavelengths anywhere from 450 to 1200 nanometers, and where we use cutoff filters to choose the wanted wavelengths. We can work with different filters for different indications. But the really important fact about IPL is that the light is pulsed. With every pulse, the target organ gets more and more heated, while the surrounding epidermis gets a chance to cool off. This way, we can get much more efficient treatments with IPL than with lasers. In hair removal, we have to consider the growth phases of hairs, and on most body areas, except for the scalp, repeated treatments are necessary to remove most of the hair permanently. In skin rejuvenation, we can treat several different aspects. Persistent erythema, telangiectasias, and superficial thin veins can be permanently removed, usually with only one treatment. Solar hyperpigmentations and other pigmented lesions can be removed the same way. Pigmented lesions have to be diagnosed before treatment, as you do not wish to treat possible malignancies or melasma. The third component of skin rejuvenation is a subtle biological stimulation of the dermis, leading to new collagen formation and skin tightening. A series of 3 to 6 treatments is usually needed. Over the years, I have worked with a lot of different lasers and at least 15 different IPL machines. Since a few years back, I have a Powerlite 600 XL in my clinic, and I and my staff are very satisfied with it. It is very efficient for hair removal since it has a very large treatment area. It charges very fast, and the treatment head is lightweight. Moreover, the pulse design is unique compared to other IPLs, since you may have up to 20 pulses in one shot. Now I will go on to demonstrate how we do hair removal and skin rejuvenation with IPL. Now we will demonstrate hair removal with IPL, and we will use the red treatment head of the Powerlite machine. As you can see, the treatment area is very large and the head is lightweight. Before treatment, we cut the hairs. They should be no longer than 2 or 3 millimeters. And before treating, we put a refrigerator cold gel over the treatment area. The thickness of the gel layer should be anywhere between 1 and 3 millimeters. You should spread the gel out evenly and try to avoid air bubbles. Before treatment, we put on the safety glasses. When treating, it's really important to keep the handle at right angles to the skin, and it's also advisable to have a systematic approach, going from one end to the other. You push the button and you hear a slight sound when the head is charged and ready to put a pulse again. As you can see, you can cover large areas in very little time. After treatment, we remove the gel, and the patient usually has no or very little discomfort after treatment. Sometimes you have a slight tingling sensation in the skin or a sensation of slight warmth, but really no other side effects. Some of the hair may be removed already at the treatment day, but most of the hair will come off in 10 to 14 days after treatment, when the action of the muscle erector pili is no longer present. The interval between treatments is depending on body area, but usually between 4 and 8 weeks. Now we will demonstrate skin rejuvenation with IPL using the yellow treatment head of the Powerlite machine. The yellow head has a smaller treatment area than the red head, which enables us to treat small areas like the area around the eyes or the nose. In skin rejuvenation, several different aspects of skin aging can be treated. Slight erythema, telangiectasias and superficial veins, for example around the nose or the cheeks, can effectively be removed, often with only one treatment. All kinds of hyperpigmentations, for example solar hyperpigmentations, can also be reduced quite importantly. But the most important aspect of skin rejuvenation is the subtle stimulation in the dermis, where we actually get a new collagen formation, which in turn gives us skin tightening and higher elasticity of the skin. I usually put gel on one part of the face at a time, for example one cheek or the forehead or the middle area of the face, and we will start out with the left cheek. The gel should be spread out evenly, a few millimeters thick, and it's important to avoid air bubbles. The gel is kept in the refrigerator to keep it cold. I like to use a spatula to put the gel evenly in the treatment area. Before treating, we put on safety glasses. Always keep the treatment handle at right angles to the skin and be systematic, going from one end to the other. After each pulse, you will hear a slight sound from the machine indicating that it's fully charged again, and you can put a new pulse in the treatment area. As you can see, even with this smaller head, very large areas can be covered in very little time. I also like you to have a look at the gel layer. It's quite obvious where you have been with the head. You make a pattern from the treatment head, and this helps you to be systematic and to not do overlaps, but not to miss any of the areas either. After treating each area, I remove the old gel and then I go on and put gel on the next area. There is usually a slight erythema the first 24 hours after skin rejuvenation treatment, and if you have pigmentations, they may become more marked and a little bit darker for the first 1 or 2 weeks. After 2 weeks, most of the pigmentations have been completely removed. It's important to inform the patient that the erythema is a normal following the treatment, and that it will recede within 1 day. There is no real discomfort for the patient after treatment, only a slight sensation of heat and a little tingling in the depth of the skin. The elasticity and the increase of collagen formation goes on for many weeks after treatment, and you actually get more and more results after one treatment, up to 4 to 6 weeks after the treatment. For optimal results in skin rejuvenation, we recommend a series of treatments 2 to 4 weeks apart, and usually 4 to 6 treatments per treatment schedule.